Okay, let's talk about that pain. The kind that just sticks around. Maybe it's your back, maybe something else, but it just lingers.
Uh-huh. That persistent ache.
Exactly. And you've probably been looking everywhere for answers. So today, in this deep dive, we want to help make sense of some of that information you've gathered.
We're going to look at chronic pain, specifically some, well, newer ways to figure out what's really going on.
Right. Thinking about different types of chronic pain and some specific advancements in diagnosis, like the techniques Dr. Maz discusses in the sources.
It's about getting more precise, moving beyond guesswork.
So our mission today, clarity, and maybe a little bit of hope when it comes to managing this stuff.
Absolutely. Because chronic pain isn't just one thing, is it? It can show up in so many ways. That backache you mentioned is common, but it could be headaches, nerve pain.
Yeah, and finding the exact source. Historically, that's been tricky, hasn't it?
Oh, definitely. Treatments used to be, well, broader, maybe less targeted, almost like casting a wide net and hoping for the best. Now, things are shifting. We're getting much better at zeroing in, understanding specific structures, like, for instance, the facet joints in the spine is a big part of that.
Okay, facet joints. I saw Dr. Maz used a great analogy like hinges on a door, but in your spine.
That's a perfect way to put it. There are these small joints between your vertebrae, and they're crucial for allowing you to bend, to twist, movement.
Makes sense. Like any hinge, though, I guess they can wear out over time.
Exactly. Wear and tear, arthritis.
Right.
It can happen. And when it does, these joints can become a source of chronic pain. Sometimes it's pain that doesn't scream facet joint issue on a standard X-ray or MRI looking for, say, disc problems.
So it can be a bit hidden.
It can be.
Yeah.
And the pain signals from these problematic facet joints, they travel along very specific nerves. They're called the medial branch nerves.
Medial branch nerves, okay.
And here's the key thing. These nerves, their only job, pretty much, is to carry pain signals from those specific joints. They don't control muscles. They don't give you feeling in your legs or arms, just pain signals.
Wow, okay, so they're really specialized.
Very specialized, which is actually quite useful when it comes to diagnosis. It allows for a really targeted approach. That level of specificity, well, it's a significant improvement over older methods.
Which leads us to this procedure, the medial branch block. Dr. Maz explains it as a kind of test, right?
Exactly. It's primarily diagnostic. What happens is a physician injects a small amount of local anesthetic, like the stuff that dentists uses to numb your mouth.
Right, that Novocaine feeling.
Yeah, that kind of thing. It's injected very precisely near those medial branch nerves.
So it's not just numbing the area generally, it's specifically targeting those nerves to see if switching them off switches off the pain.
Precisely. You're temporarily blocking the pain signal right at the suspected source. The whole thing is usually pretty quick, maybe 15, 20 minutes.
And then you go home the same day?
Typically, yes. And the main goal, remember, is diagnosis. If your pain gets significantly better, even just for a few hours while the anesthetic works,
then you've likely found the culprit. Those medial branch nerves, those facet joints.
you give strong evidence that's where the pain is coming from. It's like flipping a switch off temporarily to see if the light goes out.
That makes a lot of sense. And Dr. Maz also mentioned if this block is successful, there might be a next step for longer relief, something called radiofrequency ablation.
Yes, and that's where this diagnostic precision really pays off. If the block works, radiofrequency ablation is an option. It uses heat generated by radio waves to essentially disrupt those specific medial branch nerves more permanently.
More permanently meaning?
Well, not forever, but for a good while, often giving pain relief that lasts, say, 6 months, maybe 12 months, sometimes even longer for some people.
Wow, 6 to 12 months is significant.
It's a huge improvement compared to just managing symptoms day to day, especially when you think back to how difficult pinpointing and treating this specific type of pain used to be. This whole approach to the block, potentially the ablation, it's a great example of how pain management is becoming more targeted.
Yeah, and it sounds like Dr. Maz, based on the source material, has a really reassuring way of explaining this stuff. That must make a difference for patients dealing with chronic pain.
Having that knowledgeable, friendly approach is definitely key.
So the big takeaway here for you listening is that something like a medial branch block is a really specific diagnostic tool. It can help figure out if those little hinges in your spine, the facet joints, are the source of your pain.
And importantly, it can be that first step towards getting more effective, longer-lasting relief than perhaps was possible before.
It represents a real step forward. So, maybe something for you to think about. If you have that persistent pain, especially back pain, and other things haven't quite nailed it down,
Could exploring this possibility, facet joints and maybe these kinds of blocks, be something worth discussing with your own doctor? It just shows how much things are evolving, offering more focused options. Maybe this gives you a new angle to consider or discuss.